The uppermost level of the residence is accessible via an internal stairway from the second level and contains 2 bedrooms. One bedroom on the third level was reportedly assigned to Kaylee Goncalves, and the other bedroom was assigned to Madison Mogen. The bodies of Kaylee Goncalves and Madison Mogen were reportedly discovered in the bedroom assigned to Madison Mogen. Madison Mogen was located on the south side of the bed, closest to the closet opening, and Kaylee Goncalves was located on the north side of the bed, closest to the wall. Both were covered with a beige comforter. A white fleece item, appearing to be a blanket, was lying at the foot of the bed. Madison Mogen and Kaylee Goncalves were lying on their backs. Kaylee Goncalves was partially lying on top of the right arm, right shoulder, and upper torso of Madison Mogen. The bodies of Kaylee Goncalves and Madison Mogen can best be visualized when the comforter is removed. No blood was noted on the bottoms or tops of their feet, indicating they were not upright or moving about the area after their bloodletting injuries were inflicted. The blood visible on the bottom sheet was limited to the upper portion of the bed sheet at approximately chest level. According to the respective autopsy reports, no bloodletting injuries were reported below the waist or on the backs of either Kaylee Goncalves or Madison Mogen. An image taken at autopsy F the sleep pants of Kaylee Goncalves. The lack of blood on the front of her sleeping pants further supports the conclusion that Kaylee Goncalves never stood upright after the bloodletting injuries to her upper body were inflicted. Madison Mogen's left leg was extended from under the bed covers, and her left foot was on the floor. A piece of debris was noted on the floor between her left foot and the pillow. A swabbing of this debris, as well as the debris itself, was tested for the presumptive presence of blood. The swabbing yielded a positive presumptive test for blood at the scene, but the otolidine test conducted at the laboratory was weakly positive. There were no drip trails of blood noted on the bedroom floor. Drip trails are indicative of movement by a bleeding individual. In one image, the comforter had been turned into Addison. Mogen was extended from the bed. Drip stains, spatter stains, transfer stains, and saturation stains were visible on the comforter and exposed bed sheets. Apparent strands of hair were also visible on the comforter. A large pool of blood accumulated at approximately the thigh region of Kaylee Goncalves, even though, according to the autopsy report, no injuries were reported in that area to account for this pool of blood. For this large pool of blood to accumulate, a source of blood had to be above this area while bleeding occurred. The analysis notes that impact-related spatter is present on all 4 walls of the bedroom, above the head of the bed, on the south wall beside Kaylee Goncalves, on the north wall, and on the door at the foot of the bed. These areas are identified as significant and are described in greater detail as the report progresses. Multiple impact spatter stains and 2 cast-off patterns are identified on the north wall to the right of Kaylee Goncalves. The directionality of the spatter closer to the doorway is right to left and downward. The area of convergence indicates that the spatter-producing events originated from a location above the level of the bed. The cast-off patterns are consistent with the movement of a blood-bearing object during the event. Spatter stains are also documented on the door casing and the exterior surface of the bedroom door. The shape and placement of these stains are consistent with a continuation of the impact spatter observed on the north wall. This supports the conclusion that the spatter originated from impacts delivered to a source of exposed blood located on the bed. The findings collectively support that the bloodletting events occurred while the victims were on the bed, with impacts occurring above mattress level. The lack of drip trails on the floor, combined with the distribution of spatter, pooling, and transfer stains, indicates minimal to no movement by a bleeding individual after the injuries were inflicted. These observations are used to assess body position, posture changes during the event, and the relative timing of bloodshed, rather than to infer motive or sequence beyond what the physical evidence